This recording is a part of the series that's covering the reproductive system, and this one specifically is going to look at hormones in male reproductive function. So here we're looking at a picture similar to what we've seen before, but we're going to be a little bit more specific looking at the male. Now again, at puberty, so that's important, it's at puberty, these are things that are going to happen. So at puberty, you're going to have this pulsatile release of gonadotropin releasing hormone from the hypothalamus. And that hypothalamus, or the gonadotropin releasing hormone from the hypothalamus, will travel down and target the anterior pituitary. Now, do you remember how gonadotropin releasing hormone gets to the anterior pituitary? How does that tropic hormone get there? Do you remember the hypophyseal portal system? If not, I'd go and look at it again. So gonadotropin releasing hormone travels to the anterior pituitary, and it's going to stimulate the secretion of, one of it's going to do is luteinizing hormone, LH. LH targets the Leydig cells, which are within the testes. Now, they are not within the seminiferous tubules. They're referred to as interstitial cells. They're outside of the seminiferous tubules. And the seminiferous tubules is kind of like what you're seeing right here. So these cells produce testosterone in response to luteinizing hormone. So luteinizing hormone is a tropic hormone. So testosterone will target other organs. We're going to be looking at some of the effects it has on other organs, but also because, again, it is lipid soluble, it can easily cross cell membranes. And it's actually going to go into the seminiferous tubules, and it's going to be very important in normal spermatogenesis. And you actually need very high concentrations of it. And what we have within the seminiferous tubules, we have this protein called androgen binding protein. That's what ABP stands for. Androgen binding protein. That protein is produced by Sertoli cells. So you see all these large pink cells here. Sertoli cells are very important in spermatogenesis. They're secreting a number of factors that are needed for normal development of the sperm. And you see, starting out here, we've got some spermatogonium, but then what's going to happen is, under the influence of FSH will be released by the anterior pituitary, and through second messenger systems, it's going to kind of promote, and actually I should say that receptor is on the Sertoli cell. And so it's allowing the Sertoli cell to produce a number of factors that are necessary for gametogenesis. The Sertoli cell also produces androgen binding protein, which binds to testosterone and keeps the levels of that hormone extremely high within the seminiferous tubules. Because testosterone, remember, is again hydrophobic. It can easily cross membranes, and it can just go out other places. So we want to make sure we trap a whole bunch of it right there, because that is necessary for normal development of the sperm. So you start with the spermatogonium out here. Eventually you're going to come in, you get the primary spermatocyte, secondary spermatocyte, the spermatid, and then eventually your spermatozoa. And so that Sertoli cell is producing a number of factors that help with that, and that testosterone is helping with that too. So you have the FSH and LH both secreted by the anterior pituitary. Both are needed in one way, shape, or form for normal gametogenesis. FSH targets that Sertoli cell. LH targets the Leydig cell. That Leydig cell produces testosterone, which is needed for normal spermatogenesis. Now, testosterone is going to be used for other different things too, so it has other effects. Now, I do want to mention something else in regards to that Sertoli cell. Is the Sertoli cell, besides making that androgen binding protein that binds to testosterone, the Sertoli cell also contains aromatase. And so some of the testosterone produced by the Leydig cell will actually be converted to estradiol. So testosterone is going to be converted to beta estradiol by the Sertoli cell, and that beta estradiol is actually also needed for spermatogenesis. And I want to also to remind you that estrogen is also needed for within the epididymis. So the absorption of fluid by the stereocilia in the epididymis is estrogen dependent. So the sperm are produced in the seminiferous tubules of the testes, but they mature in the epididymis, and all that sperm is going to be drawn into the epididymis, and it needs a lot of fluid to do that. But while it's sitting there in epididymis, and I spelled epididymis, sorry, wrong. There it is. That fluid, excess fluid is absorbed by the stereocilia within the epididymis. So estrogen is needed for a number of different things in the male. Now, so what are some of the actions of these androgens? So androgens is the generic term for these male sex hormones. So before birth, so during embryogenesis and fetal development, both DHT as well as testosterone are necessary. So testosterone, you need it for help with the development of the epididymis and the seminal vesicles, the vas deferens. Testosterone is also needed for descent of the testis into the scrotum. That doesn't happen. Results in cryptorchidism, which I've mentioned in a previous recording. DHT in before birth is needed for formation of a lot of the male external genitalia, like the penis and the scrotum, the urethra, which runs right down through the penis. Now, the prostate is not external genitalia, but it's also very important in the development of the prostate. DHT will also be very important after birth with the prostate. Now, remember, DHT is made by converting testosterone to DHT using 5-alpha reductase. So if you don't have sufficient levels of 5-alpha reductase, then you won't be able to produce DHT, and that could cause issues before birth with the development of certain male reproductive organs. Now, after puberty, what you'll notice is once a male child hits puberty, they're going to start to have some certain changes that take place, very important in male secondary sexual characteristics, and this is going to be important throughout adulthood. It's also going to be important in spermatogenesis too. So after puberty, DHT is needed. It's also important in spermatogenesis as well as testosterone. So you see the little sperm right here. DHT is also, the big things that it is very important is prostate gland. It's a primary androgen in prostate gland for growth, prostate growth. It's important in facial and body hair. And also it affects the production of sebum, which is that oil that we see that makes the hair kind of more pliant, but also makes it very greasy if you overproduce sebum. So at puberty, DHT is necessary for that. Now, men who can't produce facial hair that much or body hair, it's pretty much due to one of two things. One is number of hair follicles. Typically, men that have more hair follicles will have denser and coarser beards. But one would say, well, men that can't grow beards or body hair have lower testosterone levels. That's actually not correct. They typically have normal testosterone levels. It's generally one of the bigger things is sensitivity to DHT. So you have a lot of DHT that's going to be needed for beard growth or production of facial and body hair. Is lack of sensitivity to DHT can lead to kind of the hard time growing the beards or very patchy beards. One thing that's interesting is DHT does not has a different effect on your head hair. The hair on your head is actually over time, DHT can build up in the hair follicles on your head and actually cause it. You'll lose your hair on your head and lead to associated with male pattern baldness. So you can see men that are bald but have full heads of hair. So that's kind of an interesting thing. After puberty, with testosterone, it's needed for growth of the sex organ, so it develops into what you see with an adult. It's important in the skeletal system. So you see here, it helps to strengthen the bone. It has an anabolic function. It's important in protein synthesis, which results in more bone matrix, the osteoid. So it's needed for that bone matrix, referred to as osteoid. It also increases the deposition of salts, the calcium, and all the other salts that makes the bone much stronger. So men have much stronger bones than female. The peripheral conversion of testosterone to the beta estradiol, because of the aromatase activity in adipose tissue, is important in the maturation of bone. It's also needed for increased muscular growth. It's responsible for the change in the voice, the vocal cords of the larynx, to get the lower pitched voice after puberty. It's also, again, important in spermatogenesis. It increases red blood cell production and have more red blood cells than the female. And also it increases metabolic rate. So men have a higher metabolic rate than the female. So testosterone has a number of different effects, and these are just some of them. Okay, so these are just some of the effects of testosterone and DHT. So this is the last for looking at the males and the hormonal functions in the male reproductive system.